This is one of the most exciting projects I've ever had the opportunity to work with. It started as we worked with blue zones and trying to figure out how we can work with the Healthy 100 movement. We worked very closely with the blue zones and figuring out, would we become maybe this area the next blue zone? And when the team came last year to visit, we realized we already had a lot of great pieces already in place and just needed to connect them, which is what we've been working on right now, to try to connect the wonderful departments, groups, services that are already in our community for a focused view for our citizens to see a united health front.
The Healthy Central Florida project is a project that's really been in the works for, I'd say now about 15 months. About 15 months ago, we originally started looking at the opportunity to apply for a project, apply for funding for a project called Vitality City and the Blue Zones project. As time went on, we realized that we really had the capacity within our community to do the work ourselves without paying a third-party consultant a large amount of money to do the program for us. So, since Florida Hospital and Winter Park Health Foundation had been really the two founding organizations working on the Vitality City Blue Zone project, we decided that we would continue to talk to see if there was a way that our two organizations could come together to fund this new project, which became known as Healthy Central Florida.
We formed kind of our own task team, and that is what has become the Healthy Central Florida. So that involves Florida Hospital, Winter Park Memorial, kind of taking the lead on that, as well as the Winter Park Health Foundation, kind of as the two parent companies. And then the City of Winter Park is highly involved, City of Maitland, and City of Eatonville. We also have Orange County Public Schools, Orange County as a whole, the YMCA, and then various other organizations in town who've stepped up to the plate.
The goals for Healthy Central Florida are 4 things. We're focusing on getting folks to be more active, get out, walk more, bike more, move more, whatever that is. Take the stairs at work. Little steps can add up to big changes. So movement is the first thing. Getting people to eat healthier, more fresh fruits and vegetables in particular, less sugary sodas, less processed foods. Then we're also focusing on getting people to quit smoking, and there's a big effort in our community right now, so the timing is great to work on that. And then lastly, we're going to be measuring happiness and well-being. We know that emotional health and physical health are very closely linked. And one of the ways that we're going to do that is research also shows that social isolation, when neighbors are disconnected, when communities are fractured, that there's less well-being. And so one of our goals will be to connect residents through community centers, through activities, through the YMCA, through partners, and we're working with lots of great partners to do this work.
I'd like to see people live longer. I'd like them to take an active role in their life and really reverse these trends that have been happening.